I'm glad to inform you that about 3 days ago, I had requested government bodies and everyone to be serious about this, and I had appealed to Patanjali as well through my video. I run a video channel, YouTube channel, and I had requested them to present the detailed data of their clinical trials so the world knows what exact uh, clinical trial they have conducted and what their patient groups were and the results they have observed in their patients, so it can be critically analyzed, reviewed, and can be used nationally and internationally. But on the in the press conference they carried out about 4 or 5 days ago, Patanjali's Balakrishna, he declared that they will be back with the results of the clinical trials in few days. And we, people like me in medical faculty who are directly dealing with COVID cases, we were waiting for their clinical trial results. Meanwhile, I looked into the details of Patanjali's clinical trial on Ayush website, on ICMR, WHO, as well as on Patanjali related sites. And unfortunately, I couldn't find a single evidence of their trials or experiments registered with any of these legal bodies. Normally, if some firm, institution, or hospital is conducting trials, they will be declared the details of the trial, their trial design, number of patients, and what they are observing and what they are expecting. Everything is given in great details on the websites of these pharmaceutical companies. They are also declared on the websites of government bodies like ICMR or Ayush Ministry in India, and WHO knows as well. If you remember, I had mentioned in the past that WHO, sorry for this helicopter noise, WHO had declared in January, had appealed to various alternative medicine people all over the world to come up with well-designed trials in the management of COVID-19. And at the same time, Ayush Ministry had also asked for proposals, and they received few thousand proposals from alternative medicine people in the management of COVID. And few of them are being trialed in India in few hospitals from Ayurveda medicines as well. But Patanjali trialing some medicine is not registered anywhere. At least I couldn't find on government websites or in the WHO list of trials being conducted. Now, instead of declaring the trial, they have now launched the product straight away, and they are claiming that it is 100% effective and 70% people recover in so many days and all that. So this has to be looked very carefully. This cannot be accepted as a scientific medical evidence in this era. This is a 21st century, so we cannot accept this. So I had appealed to the Patanjali team as well and to government as well 3 days ago, and I'm very thankful to Ayush Ministry and PMO India that they have now asked Patanjali to stop advertising, stop making claims with regards to their medicine for COVID-19, and they have also asked for evidence of their clinical trials. Now, friends, but I have some reservation. Ayush Ministry and even the Prime Minister's office in India were themselves advocating some kadha and some homeopathy medications as a preventive and curative form of treatment for COVID-19. And that was baseless. That wasn't based on any scientific evidence anywhere in the world. Now, Ayush department asking for results of clinical trials and details of clinical trials can be a bit of dodgy business, because I'm not sure who will critically review this trial papers, the design and the study details. They need to make sure that the people who will look into these trials, their details, are actually capable, are competent to look into the scientific evidence. We don't need people from allopathy or Ayurveda practitioners. We need someone who is expert in looking into the evidence. That is what we are lacking in India. When somebody like me tries to talk about evidence for homeopathy or Ayurveda, people raise questions. You are an allopathic doctor. Why are you talking about homeopathy and Ayurveda? So people just don't understand that I'm not talking about the Ayurveda or homeopathy medicines. I'm talking about the evidence for these medicines in particular condition. They're altogether two different phenomena. So Ayush needs to make sure these papers are critically appraised quickly, so everybody knows what they are, and it should be open and transparent. There shouldn't be any indoor deal between Patanjali and the government bodies. That has been happening in last few years, because Patanjali Supremo, Balkrishna and Ramdev have been very close to the people in the government. So the people, citizens of India, they will doubt if these things are not handled openly and transparently. So we expect that thing to happen. But having said this, I'm really thankful to Ayush that people like me have been raising voice and have been asking for clear-cut evidence and details of the trials and their designs, and now Ayush has asked them. So I'm thank you for Government of India and Ayush Department, Ayush Ministry of Government of India. So what we expect now from them is to make it clear the quality of the study, make it clear the evidence produced from their study, what type of study it is, what grade of evidence it is, and whether that is actually recommendable in COVID-19, and what patient type, because COVID-19 could be asymptomatic, it could be mild, moderate, severe, somebody who is severe on ventilator in critical care unit, or somebody might want to use it as a preventive treatment, because that is what is going to happen. If it's available in general stores and pharmaceutical shops, then people will just buy it and start taking it so that they don't get COVID. So government bodies need to give clear-cut idea to the public, to the stores who will sell the medicines, and accordingly then Patanjali literature should include these instructions, specifically mentioning why these medications have been released and what the evidence is. So this will relieve people of the confusion, stress, and this will also stop the financial exploitation of poor people who are now very anxious, afraid of COVID, and there is an uncertainty and this fear, and people like Ramdev, Balkrishna shouldn't be allowed to exploit people in this scenario. So thank you again, Ayush Department. Now I will continue in Marathi.